Welcome to The Explainer. Today, we are talking about a massive, revolutionary shift in medicine. For decades, when we talked about treating type 2 diabetes, it was all about one thing: lowering blood sugar. But that's all changing. The goal now is so much bigger, and frankly, it's saving lives.
And this quote right here, it says everything. Professor Albright just nails it. The old way of thinking, just treating sugar, is completely outdated. Because we now understand that type 2 diabetes isn't just about blood sugar, it's a huge risk factor for heart attacks, for strokes, for kidney failure. So the new goal isn't just to manage a number, it's to actively protect the entire system.
So here's our roadmap for today. First, we'll unpack this huge shift in thinking. Then, we'll meet the two new heroes in this story, two new classes of drugs that are changing everything. We'll see how they stack up against each other. And finally, we'll look at the new playbook doctors are using that puts heart and kidney health front and center.
All right, first up, the big shift. To really get why this is such a massive deal, we actually have to go back in time a little bit to a moment that really changed everything.
So before 2008, there was this cloud of uncertainty. Some older diabetes drugs were actually suspected of being bad for the heart. So the FDA stepped in and laid down a new rule. From now on, any new diabetes drug has to go through rigorous testing to prove it's safe for the cardiovascular system. Now, this was just supposed to be a safety check, right? But it led to one of the biggest accidental discoveries in modern medicine. These trials started showing that a few new drugs weren't just not harmful, they were incredibly beneficial. They were actively protecting the heart. It was a complete game changer.
So, what's the new target in these clinical trials? It's something called MACE. You can think of MACE as the big three of bad outcomes: heart attacks, strokes, and death from cardiovascular causes. This is the new enemy. Yes, blood sugar is still important, but preventing MACE, that's the new holy grail. Because that's what really saves lives.
And that brings us to the first hero in our story, a class of drugs called SGLT2 inhibitors. Let's think of these as the heart and kidney guardian.
So when researchers were studying these guardians, they were looking for MACE reduction, but they stumbled upon something else that was absolutely stunning. They saw this huge, unexpected drop in one specific, devastating problem: people being hospitalized for heart failure.
And this number says it all, a 35% reduction. You have to understand, heart failure is notoriously difficult to treat, so seeing a number like this was just a massive victory. This was the light bulb moment when everyone realized, whoa, these aren't just sugar pills, these are powerful heart-protecting drugs.
So how on earth do they do it? Well, their magic isn't about cholesterol. It's something called a hemodynamic effect. In simple terms, they help your kidneys flush out excess sugar and salt. This reduces the overall fluid volume in your body, which lowers your blood pressure and, most importantly, eases the physical workload on your heart. It's like taking a huge, heavy backpack off a marathon runner. Suddenly, the heart can just work more efficiently.
Okay, time to meet our second hero. These are the GLP-1 receptor agonists, and we're going to call them the artery protectors.
Now, these drugs have a totally different superpower. While the guardians focus on reducing the physical strain on the heart muscle, these protectors go to work inside your arteries. Their main job is to fight atherosclerosis, that dangerous buildup of plaque that's the root cause of most heart attacks and strokes.
And the numbers here are just as impressive. Look at this, a 26% reduction in MACE shown in a major trial. And they were particularly good at lowering the risk of stroke. So again, we're not just tweaking a lab number, we're preventing life-altering, catastrophic events.
Their strategy is completely different. They work by cooling down inflammation in the blood vessels, which we know is a key driver of plaque. They also help to stabilize the plaque that's already there, making it less likely to rupture and cause a blockage. Oh, and they come with a major bonus prize that you've probably heard about: significant weight loss, which is, on its own, a huge benefit for your heart.
So now we have two powerful new tools in the toolbox, each with its own specialty. And this leads to the big question for doctors and patients everywhere. How do you choose the right one?
This table really breaks it down perfectly. It's not about which drug is better in a vacuum. It's about matching the drug to the patient's biggest threat. If heart failure or kidney disease is the #1 enemy, you call in the guardian, the SGLT2 inhibitor. But if the primary danger is plaque buildup leading to a heart attack or stroke, well, that's a job for the protector, the GLP-1 agonist. You pick your hero based on the villain you're fighting.
But here's the critical question. What if a patient is fighting both villains at once? What if they have a strained heart muscle and dangerous plaque in their arteries? This is an incredibly common scenario, and the answer to this question leads us straight to the new treatment playbook.
All right, let's look at the new playbook. This is all about a personalized strategy that's all about one thing: prescribing to protect. It's replacing that old one-size-fits-all approach for good.
So here's how it works now. You still start with the foundation, which is metformin and lifestyle changes, but the very next step is to assess the specific risk profile. Then you deploy the right protector for that specific risk. And, this is the key, for those highest risk patients, you combine forces. You use both a guardian and a protector together. It's like assembling a superhero team for maximum protection.
Now, the science behind this new playbook is crystal clear, but we have to talk about the real world. And in the real world, there are other factors, and a huge one is cost. This data from Canada shows a pretty dramatic price difference between these two classes of drugs, and that can, of course, have a huge impact on access for a lot of people.
And like any medication, they have different side effect profiles. The SGLT2 inhibitors might increase the risk of things like urinary tract infections. The GLP-1 agonists are pretty well known for causing nausea, especially when you're just starting out. This is all part of that essential conversation between a doctor and a patient to figure out the right path forward.
Which brings us to the final, most important takeaway. This one sentence sums up the entire revolution we've been talking about. The goal has fundamentally shifted. We've moved from just managing a number on a lab report to proactively protecting a person's most vital organs for the rest of their life. It's a whole new era of proactive care, and it's already making a huge difference. The big question now is, how quickly can we make this the standard of care for every single person who needs it?